Questions and Concerns by Dr. Olga Kantor. Dr. Kantor is also a new surgeon who's recently joined our faculty here, and we are thrilled to have Dr. Kantor here with us this morning.
Thanks for having me, and thanks for joining today. So I think before we can discuss some of the common breast concerns that people kind of seek attention for, it's just important to understand the structure of the breast. And so if you look at the picture on the right, the breast is really made up of lobules, which make milk for breastfeeding, and the ducts that just kind of that the milk travels to the nipple. And then surrounding those ducts and lobules, you really just have connective tissue and fat that makes up the rest of the structure of the breast. And then of course the breast overlays on the chest wall muscles and then the underlying ribs. And so this will all kind of come into play as we talk about some of the common breast concerns that do happen in women. And really the four most common things I would say that patients ask me or that women seek attention for is pain in the breast, lumps in the breast, discharge from the nipples, and then changes in either the skin of the breast or the nipple itself. So breast pain is probably the most common breast problem that women experience, but what causes breast pain? So there's actually a variety of things that can cause breast pain, one of which is just normal hormonal fluctuations of our body's natural estrogen and progesterone. It can affect the breast during, obviously during menstrual cycles, during pregnancy, it could cause pain and tenderness, and then even during menopause when the hormonal balance is shifting to establish a new normal. Another cause is inflammation or trauma to the breast. The breast can be bruised just like tissue anywhere else in the body if you do have some kind of traumatic incident to the breast, like a seatbelt injury in a car accident or something along those lines. And then also the breast overlies the pectoralis muscle or the pec muscle. And so if you are sore from exercise or you have inflammation in that muscle, sometimes that can manifest as pain that seems to be in the breast itself. And you can also, some women have pain along the border of their ribs near the breastbone, and that can also sometimes present as breast pain. And so when inflammation is the cause of pain, sometimes a short course of anti-inflammatory medications, just such as over-the-counter ibuprofen or Motrin, can actually help with that type of pain. Infection can also cause breast pain, and usually this can be associated with redness and pain that's really focal at one specific area. And this should always be checked out by a medical professional because you might need antibiotics or sometimes even drainage of the area. And the structure of the breast itself can be a source of pain. So the breast has ligaments, which we call Cooper's ligaments, that help keep its shape. And when the breast is not well supported, or sometimes with larger breasts, also with gravity and just over time, these ligaments can stretch or break, and this can manifest as pain and inflammation. And so for this reason, we recommend wearing a supportive bra, especially when exercising, and that can often help when women are experiencing breast pain. And lastly, caffeine, smoking, and certain medications such as diuretics can cause breast pain. They have been linked. And so, cutting back or stopping smoking and decreasing your caffeine intake often can make a difference. And then lastly, I just want to point out that what you don't see on the list of kind of the common causes of breast pain is breast cancer, because pain is very rarely associated with breast cancer. So moving on to lumps in the breast. So this is another common cause of, breast concern, obviously for women. And so there are a few questions you can ask to help sort out, what a lump in the breast might be. So what does the lump feel like and how big is it? Does it change over time or with menstrual cycles, as Dr. Laws alluded to? And does it hurt? So there are lots of causes of lumps in the breast, and a new lump in the breast should always be checked out by a medical professional. But just to kind of talk about some of the common causes, could you go to the next slide, please? Starting from the top, a breast abscess or a pocket of infection Usually that would be associated with redness, pain, and sometimes even fever or feeling unwell. Moving down the list, fibroadenomas are common breast lumps, especially in younger women. And these are often associated with tenderness over the area, and tenderness that tends to fluctuate with menstrual cycles. And these can also fluctuate in size with menstrual cycles because they tend to be hormone dependent and so fed by hormones. Cysts can be normal in some women, but they can change in size. And if large, they have a shell that can feel like a hard mass. Fibroadenomatosis is kind of a combination between fibroadenomas and cysts that can be associated with women that have fibrocystic changes. And we'll talk a little bit more about that in the next slide. And then of course, a tumor can cause a lump that is often painless and firm. And so that's really what we always want to make sure is not the cause, and why if a new lump occurs in the breast, you always want to get it checked out. So some of you may have heard of this term fibrocystic breasts, which we also refer to as lumpy bumpy breasts. And the picture on the left just shows a normal breast. And then the picture on the right shows a woman that might have fibrocystic breast changes. And usually this can be associated with cysts and pain. And it can be hard for these women to examine themselves because the whole breast just feels lumpy bumpy. So sometimes it can be helpful to follow with a breast specialist annually for exams in women that do have fibrocystic breasts. A third common problem is nipple discharge, which is obviously very concerning to women because it's not usually normal outside of breastfeeding. So nipple discharge actually can come in many different colors, and I think this diagram does a nice job just summarizing some of the common causes of nipple discharge. So starting from the top, clear nipple discharge is usually associated with duct ectasia, which is just a fancy word for kind of some debris and dilation of the ducts that can occur. Milky discharge is usually associated with breastfeeding, but can also be related to kind of hormone abnormalities. Yellow discharge can be associated with infection, and then both green and brown discharge can be associated with fibrocystic disease, and also sometimes with duct ectasia. And then bloody nipple discharge, the most common cause is usually an intraductal papilloma, which is a small benign lesion that can form inside the lining of the duct. But in rare cases, bloody discharge can be associated with underlying malignancy. And so especially when it's only on one side, we do get worried about that, and that should always be checked out by a physician. And so lastly, the skin of the breast or nipple can have changes really just like the skin anywhere in the body. And so some things that you might notice on the skin of the breast are irritation, rash, moles, or kind of new skin changes that look like moles. And sometimes, especially in women that have larger breasts, you can actually get infections like yeast infections under the breast, and also just irritation in that area from the breast rubbing along the abdomen. And then in terms of the nipple, women can have nipple inversion, rash, and cysts. And definitely any changes in the nipple should be checked out by a physician. So there's obviously a lot of questions and things that might come up when you're doing self-breast exams. So when should you be concerned? So if there's a new change in the breast that doesn't seem to be getting better with a little bit of time or is getting worse, and then any change in the breast, such as dimpling of the breast or a change in kind of the outward appearance, a new inversion of a nipple that wasn't previously inverted, any breast lump, and really any skin and especially nipple change should always be checked out by a physician. And often we would want to get some breast imaging to make sure that everything is okay. So thank you for your attention, and I am happy to take any questions.